Life-threatening allergic reaction, or anaphylaxis, is a serious health and safety issue, especially in our schools. Whether it's caused by a food allergen, insect sting, medication, or an accidental latex exposure, anaphylaxis can be a life-threatening event that requires immediate emergency medical attention. When it comes to students with severe allergies, America's school nurses are a first line of care. Hello, I'm Tia Campbell, Vice President of the National Association of School Nurses. Welcome to the first of 3 programs designed to empower parents to partner with their child's school nurse and create an action plan that promotes allergen avoidance and has a clear course of action when it comes to emergency response. Before we get started, email us any questions you have along the way, and we'll get back to you with an answer from our guests or the NASN team. In this episode, we will cover the basics of anaphylaxis and outline the role of the school nurse as the medical expert and team leader in your school. Joining me today is fellow school nurse Susie Trotter. Susie works in the Chesterfield County Health Department in the state of Virginia and has extensive experience collaborating with teachers and the parents of students who have severe allergies. Susie, welcome to the program this morning.
Thank you.
It's good to see you again.
Good to see you.
I want to establish what anaphylaxis is for our audience that's listening today and to discover and uncover what the role of the school nurse is. So let's start by, if you could, give us a definition of what is anaphylaxis.
Okay, thank you. Anaphylaxis is actually a severe life-threatening allergic reaction to a substance that an individual may encounter, a chemical or environmental, which may be common in the environment and where you and I may have an exposure and be okay or just a little uncomfortable. Anaphylaxis is actually a life-threatening event which requires immediate action from emergency medical system.
So what can trigger an anaphylactic reaction?
Well, as I said before, there are common elements in the environment. Substances such as food may cause an anaphylactic reaction in certain individuals that have had a previous exposure and now has had an allergen sequence set up so that if they're exposed again, it will become quite severe. Food, as I mentioned, insect venom, the insect with the bees, hornets, wasps. There's also latex substances that can cause an anaphylactic reaction in certain individuals. Drugs such as penicillin and sulfa. And then some individuals do have anaphylactic reaction and there's just some unknown cause at that point.
What are some of the more common food allergens?
Typically there's shellfish as well as peanuts, nuts, other nuts, wheat, milk, eggs, but most common that we see are the nut allergies in the school setting.
To be a little bit more specific for our viewers, could you give us an example of what tree nuts are?
Sure, that would be pecans, cashews, or walnuts would be tree nuts.
Excellent. So what are some of the common areas of exposure in the school setting?
In the school setting for food, the obvious would be the cafeteria, certainly in the classroom at times. For latex, science labs may have experiments where latex would be of concern. Insect bites would be important to look at the recessed playground areas as well as ball fields. But really, it's important to do an environmental scan for the entire school area for the best safe plan for the student.
So should an anaphylactic episode occur at school, is this regarded as an emergency?
Absolutely. This is an emergency. It requires prompt and immediate action and a plan of care that can be followed, understood, and enacted very quickly for the safety of the student.
And I understand that a key role of the school nurse for students who might be susceptible for anaphylaxis is reaching out to the parents and establishing a trust relationship with that parent. Can you tell us how you go about doing that?
Sure. It's certainly an involved process for case management and understanding. Typically there's a lot of fear involved. So as the health professional, to understand where the parent is, where the student is emotionally, and their fears for their safety in the school environment. So we pretty much start there and understand what the diagnosis is, what is their allergen, what are their triggers, and then work with the parent in collaboration with the school staff to set a plan of care so that all are informed, educated, and trained to respond to a life-threatening emergency that may occur in the building.
Susie, can you talk for a minute about what you see as the key elements for an anaphylactic plan at school?
Sure. Well, certainly the diagnosis. We need to know what the student is allergic to, what are the specific triggers so that we can set a plan in place for a safe environment. Besides the diagnosis, we actually then need the order for any emergency medication treatment that may be needed. The epinephrine auto-injector is typically the first line for the immediate response for an anaphylactic reaction. So the appropriate order should be prescribed by the physician. And then from there, we need to know now how is this going to work in the school building. So we create the team to respond, who can respond, who is trained to administer the epinephrine auto-injector, where is it located, is it with the student, is it in the clinic, whose role is it to call and activate 911, EMS, who's going to notify the parent, and then the follow-up. So it really becomes live after just the initial diagnosis and the medication order.
So training is a big role of the school nurse in this instance.
Absolutely. As the health professional with the knowledge, skills, and abilities, that is the person who should be the one training laypersons, school staff, how to actually appropriately administer the auto-injector.
And we know at NASN that regulations and laws between states vary greatly with who can administer medication in the school setting, including epinephrine auto-injectors for life-threatening allergies. So it's very important for our parents and our school nurses to know what their specific state laws say regarding this particular issue. So Susie, who should be the keeper of these plans in school?
Certainly the health professional, the school nurse, is the keeper of the plan. However, everyone in the school building has an active role to assure the plan can be activated in case of any emergency or anaphylactic response in the school setting. The school nurse has the knowledge, skills, and abilities to coordinate, collaborate, and train and assure that all folks in the building are prepared to respond.
So an anaphylactic reaction can occur anywhere, but could you kind of roll out what it might look like if an incident occurred, say, in the cafeteria?
Sure. If a student were to encounter an allergen and have an anaphylactic response in the cafeteria, certainly there would be some signs and symptoms of distress. With awareness training throughout the school, certainly students can help and call an adult, or the adults that are trained and have the awareness in the environment should react immediately. They need to identify that there is signs and symptoms of alarm, call for help. That's typically up through to administration. At that point, the administration should have a plan in place based on the student's health plan on who to call, who to activate, and who to send where. And again, this is an immediate response. There cannot be a delay. And actually, this same action should occur no matter where in the building that anaphylaxis might occur.
And so is this something that we ought to be doing drills with? I know that we do fire drills and tornado drills. Should we be doing drills in our schools for emergency response?
Absolutely. I think the more that you practice, the more smooth it becomes. Get the fear and the hype out of it. This should be a standard response. It should be the same every time, and so absolutely drills would be recommended.
Good information to know. So if an anaphylactic incident should occur in the classroom, what's the role of the teacher?
The role of the teacher is to respond immediately, identify the signs and symptoms, and enact the emergency care plan. Call for help, provide assistance. If trained to administer the epinephrine auto-injector, do that immediately. Provide support while others are arriving to assist.
So what happens if there's not a school nurse to respond to an anaphylactic event?
It's a very good question, Tia, and I think it's very important for the parents to find out in the school who in the environment will be responsible for that health care plan. Collaborate with the private provider, be sure a plan is in place, and pretty much everyone in the school building should be prepared to respond, whether the school nurse is available or not.
So that really emphasizes the importance of that plan.
Absolutely. The training and the communication so that everyone is aware and can respond immediately.
What's your advice to parents of students with severe allergies who might be susceptible to anaphylaxis in communicating and collaborating to set up that plan at school?
I think there are several aspects to consider. Certainly the main aspect is bell to bell, when the student gets in the building till the end of the school day. But there are many other factors to consider in the student's environment. One certainly being transportation. Does the student need to carry it with them on the bus? Does transportation need to be aware, and who needs to be trained? Also, the parents should definitely communicate with food and nutrition office if it is a food allergy, so that that environment can be safe for that student. There are other things to consider are after-school activities. The clinics are typically not open, they are locked, and medication is not accessible. So I would encourage parents to communicate with trainers and coaches and other after-school activity coordinators so that the medication in the plan is available for anyone to respond.
So you really do see the school nurse as the go-to person in this process?
Absolutely, Tia. The school nurse is the health professional that has the knowledge, skills, and abilities to not only understand anaphylaxis and response, but also understand and navigate the school setting so that the collaboration can be there in support of the parent and student and understanding the roles of both the school staff and the parent and student needs.
Excellent. Thank you, Susie, so much for sharing your expertise with us today. When it comes to creating a safer learning environment for students with severe allergies, school nurses are the experts and team leaders driving the communication between parents and staff and are a first line of care in the event of an emergency situation. Anaphylaxis is serious, and school nurses are ready to collaborate with families to avoid exposure and implement an emergency response plan if needed. So parents, if you have a child with severe allergies, reach out to your school nurse and create that partnership today. If you have any questions for our guest or the NASN team, email them to us at the address below, and we'll get back to you shortly. And don't forget to take advantage of all of our downloadable resources. In the coming weeks, we'll launch our second episode that goes deeper into how school nurses and parents can collaborate and take a look at a partnership that could serve as a great example for you. So until then, be sure to share this program with your community. And on behalf of all of us here at NASN, thanks for watching.